to episode 5 of Ask a Therapist. The question we're addressing today is, what is hypnotherapy and how does it work? This question could be answered in a number of different ways. There's a lot of preconceptions and myths out there about hypnosis, but that's not the focus of my conversation today. What I'd like to offer you is the highly professional answer to the question. Hypnotherapy is a specialization within the field of psychotherapy and counseling. As such, it has its history and traditions and its origins. Part of those origins occurred during the First and Second World Wars, when highly experienced doctors, psychologists, and psychiatrists sought to create strategies to assist people that were dealing with the immediate effects of conflict, as well as the post-trauma recovery issues of people who were recovering during the years after the war. One excellent example of this is Dr. John Watkins, who wrote the book Hypnotherapy of War Neurosis, a clinical psychologist's casebook. This is still considered a classic in the field and is cited quite often in the literature. Hypnosis, then, as a professional field within therapy, also evolved because of the work of Milton Erickson. Ericksonian clinical hypnosis is a subset within the field of hypnotherapy, and as such goes back to the work of Milton himself. One of his favorite books that I enjoy is My Voice Will Go With You, The Teaching Tales of Milton Erickson. You see, also co-written by Sidney Rosen. Sidney Rosen is a highly acclaimed hypnotherapist and a colleague of Milton Erickson. So this is a really brief overview of what hypnotherapy is as a field. Hypnotherapy is used with a wide range of concerns and issues that people bring forward to therapy. Dr. Ruth Kidson, in her book called Hypnotherapy, Everything You Need to Know, addresses a number of these areas. As well, other books cover this. For example, Scott Lewis published a book called The Hypnosis Treatment Option. He lists a whole range of areas that hypnosis is typically used for and may be effective for people. He suggests that anxiety, stress, and phobias are part of the picture here. Dealing with asthma and asthma management, childbirth and postpartum depression, chronic pain and pain management, distress from the diagnosis of medical procedures, headache relief, migraines, tension headaches, insomnia, irritable bowel syndrome, lower back pain, pre-surgical hypnosis and post-surgical hypnosis, smoking, quitting smoking, weight management. These are just some of the areas that hypnosis has been known to be effective for people. There is some debate still in the field of hypnotherapy as to its effectiveness, yay or nay. And my take on that, in my reading of the literature and my experience, is that the more highly trained and experienced a clinician is, the more likely that they may have success with their patients, with their clients. Part of the reason here is the intention and use of language and the strategies that are developed that are tailored specifically for each individual. In fact, you can find heaps of books out there on clinical scripts, hypnosis scripts, and that is narratives of hypnosis that are used within therapy. But I have found that each particular individual needs their own specific script, their specific narrative developed for their therapy that's most effective for them in their situation. That takes a highly skilled clinician to be able to tailor solutions directly for each individual case. And I think this is part of what Milton Erickson did part of the efficacy of hypnosis as a strategy and an approach. It's highly person-centered, and it is non-invasive and encourages the best within an individual towards healing and resolution of a problem and creating change. So that's a little bit about what hypnosis is and how it works. I hope this is helpful for you. Keep your questions coming in, and thank you. Have a great day.